Welcome to Deviatus, the show where we take a detour from everyday life and explore the unexplained. My name is Jeremy, and I'm your host, and I'm very excited about today's guest, Dr. Penny Sartori. She's a researcher specializing in near-death experiences, or NDEs, and I was able to catch up with her via Skype. But before our guest, I want to do a couple quick shout-outs. Since our last episode with Bill Hartley, I've got about 4 iTunes reviews that I'd like to go over with you. The first one is from Sprague51. You'll know him as Ryan Sprague from episode 3. He says, really enjoying this show. It's crisp, clean, to the point, and very thought-provoking. I'm very much looking forward to seeing where this show heads in the future, and have no doubt it'll be one of the top shows to listen to in the world of the unknown and the esoteric. Thank you very much, Ryan. I continue to listen to your show, Into the Fray, along with Miss Shannon LeGros and Mr. Sam Sheeran. It's an excellent show. I recommend it to anybody who's interested in my show. They go over a lot of similar topics, and they always have great stuff over there. You can get more information on intothefrayradio.com. Other reviews are by Songbird54. Says, I really enjoy hearing the interviews and stories. If you're into the paranormal, you will like this show. Thank you so much for that review. Also, Mega124 says, awesome podcast. Granted, this is right up my alley and super interested, but even for those who may be skeptical, Jeremy does a great job in making these topics interesting and engaging. Great podcast. Thank you so much, Mega124. And last but not least, Marty Todd, 1991, says, I really like the idea of this podcast. I've always been interested in the paranormal, and it's fun to listen to others' experiences instead of the exaggeration of the TV shows. Fun listen. Thank you so much to all of the people who left me reviews. That is greatly appreciated, and I love the feedback that I'm getting. If you would like to leave your own review, or if you have any suggestions or comments about the show that you want to share with me, there's always the iTunes review. I'll have that link in my show notes, or you can go on deviatus.com and find the link to my iTunes show. Or you can email me at deviatuspod@gmail.com. Thanks again, everyone. I really appreciate your feedback. Now, like I said, I am super excited for our guest today, mainly because I have a lot of healthcare experience. I've been in healthcare over 20 years myself. I have worked in several different subspecialties in healthcare. But our guest, Dr. Penny Sartori, was an ICU nurse for over 17 years before she had an experience that drew her to the field of research regarding near-death experiences. She was awarded a PhD for her research as a result. She continues to speak in conferences both nationally and internationally on the subject, and her work has inspired physicians to re-examine their thoughts and practices surrounding medical treatment of ICU patients and end-of-life care. Also very interesting, her work has served as inspiration for director Clint Eastwood in making the movie Hereafter, starring Matt Damon. In Hereafter, people having their own near-death experiences connect with their deceased relatives. Matt Damon, in the beginning, plays a reluctant psychic who helps them eventually to communicate with their dead relatives. So without further ado, here is Dr. Penny Sartori. Dr. Penny Sartori is here with us today on Deviatus. Thank you for joining us, and welcome.
Oh, hi. It's lovely to be here.
So can you tell me a little bit about your background and experience as a nurse in the ICU?
Yeah, now I worked as a nurse for 21 years in total, and 17 of those years was in the ICU. And it was quite early on in my career in the ICU when I was looking after a patient who was dying, and that had a profound effect on me because although it was clear that this man was dying, we were doing everything we could to keep him alive. And I can remember just adjusting the height of the bed to do some nursing care. And the man was in so much pain, he nearly jumped out of bed in agony. And our eyes connected at that point. And it felt as if I'd kind of swapped places with him. And at that point, that made me kind of realize what he was going through. And it just had such a huge effect. And I called the doctor and he adjusted the painkillers and gave some more. But that really had made an impression on me for the rest of the night, and I couldn't stop thinking about that man. And the following day after my night shift, I went home in the morning and I just couldn't sleep because I was thinking about him constantly. So I phoned my colleagues to find out how he was doing, and they told me he'd actually died about 2 hours after my shift had ended. So I think that had such an effect on me. It made me realise that we don't understand death. And I thought, what is death all about? And I started reading about death, and that's when I came across near-death experiences. And it kind of really opened my eyes to things that I'd never really thought about before. And because my nurse training was very scientific, and I kind of thought things like this, like near-death experiences, were just some sort of hallucination or a trick of the mind as the brain was shutting down. But the more I read about near-death experiences, the more intrigued I became. And I thought, well, I'm working in the perfect place to research these. And so I decided that I wanted to undertake my own research project. And that's where it went. It went from there, really.
Now, when you say that you kind of swapped places with him, was this more of a mental thing where you understood where his thoughts were coming from, or was it physical too, where you were experiencing pain and other things?
I think it was more of a mental thing, because I didn't actually feel physical pain, but I could feel his emotions, if that makes any sense. I could feel what he was feeling, and I can remember he mouthed to me, because he was ventilated, so he couldn't talk. He had a tracheostomy, and he was mouthing to me, "Leave me die, let me die, just let me die in peace." And that really changed everything for me, because up until that point, I thought I was saving lives. And to see that man mouthing those words to me, it really made me question my role. And was I really being of benefit to all of the patients? Because this man was clearly dying.
Right. So that kind of initially launched your interest into the research field. How would you describe your research methods, and what are your ultimate goals?
Right. Well, what I did was a prospective study, and it was studying these experiences with the view that they were going to happen. So I wanted to find out several different things, because, I'd kind of looked at the literature, and a lot of people had kind of suggested that near-death experiences were due to lack of oxygen or high levels of carbon dioxide. And of course, it could have been due to the drugs that we give, because in the ICU, we do give very potent drugs and strong pain-killing drugs and sedative drugs. So I wanted to look at all of those factors to see if they were the cause of the experience. And another thing that I wanted to investigate is the out-of-body component, because a lot of people claim to leave their bodies and look down on the emergency situation from above. And I thought, well, there's one way that we could kind of verify that. If was to hide symbols around the ICU that could only be viewed from an out-of-body perspective. So that's what I did. And basically, I started off doing my research, and I would just approach each patient as they were recovering from a critical illness, and I would just ask them the question, do you have any memories of the time you were unconscious? Now, most patients didn't have any memory at all and didn't remember anything, but some of them kind of hesitated, and they said, oh, well, I did have something, and I don't know whether it was real or not, and things like that. And so I investigated it further, and when it was suitable, I then interviewed them with an in-depth questionnaire, and I followed them up where it was appropriate. I followed them up every 6 months to a year after the experience as well.
Now, that's a really particular interest of mine, is this out-of-body experience. I used to work in a cardiac cath lab myself, and I recall a patient who he had no heartbeat for several minutes. I believe it was 5 or 6 minutes. And this patient, once he was, revived, he was able to tell us what was in the adjacent room, which was not visible from where we were in the current room. And I always thought, this was pretty good proof to me. But, when you look at scientific research, somebody would say, well, that's not repeatable. It's not verifiable. But I don't see how this could be ignored.
Exactly, that's right. There's something is clearly happening, yet we kind of just dismiss it and pretend it can't possibly be true. And I think, certainly myself, doing this research, one of my patients, patient 10, he was probably the strongest case in my research, and he described an out of body experience. And at that time, when he was having the experience, his eyes were closed and he was deeply unconscious. Now, we use the Glasgow Coma score,
Hmm.
and the lowest score you can have was 3 out of 16, and his was 3. He was just not responding to anything at all. Yet he described, when he revived later, he described events that were going on when his Glasgow Coma score was that low. And so that, I know everything that he said was accurate because I was there at the time. I was the nurse looking after him. And it just doesn't kind of make sense how someone whose brain is so dysfunctional and unconscious can report something with great accuracy and great lucidity as well. So, actually doing this research has really opened my eyes in a big way.
Yeah, I would imagine so. Regarding some of your findings in general, what patterns, if any, have you noticed in some of the experiences reported?
Right. Well, a lot of people the most common component of the near death experience that I found in my research was being met by dead relatives or friends who told them that it wasn't their time, or were quite angry at seeing them and said, "You shouldn't be here, you need to go back." That was the most common thing. One or two people did have the out of body experience. Very common were feelings of peace and calm and joy.
Hmm.
And what else was there? One or two went through a transition from darkness into light, or one man described it as being a bit of a corridor with like corrugated iron on the inside. So there was
Hmm.
a quality to the tunnel. Um, and beautiful gardens as well, with lush green grass and things like that. So those were quite common for my research in itself.
Did you ever run across any sort of negative experiences?
I did, yes. There were two people who had quite distressing experiences, really. The first kind was a lady, and she had the usual near death experience, but the elements of it she had interpreted in a distressing way. She felt that she had left her body and she was looking down at herself. But then she said she could then feel herself drifting towards a river and a bridge. And she said she was terrified of water. She was very afraid of water. So the closer she was getting to the river, the more distressed she was becoming. And she said she could also hear in the background some voices or children laughing and crying. And she felt like people were mocking her. And she said it was horrible. It was just an awful experience. And then she got to the point where she was almost at the bridge. And then she suddenly said everything just stopped. And then she kind of came to, and she was in the intensive care unit. And she was convinced that she'd been dead. So that was the first kind. The
Hmm.
second distressing experience was a lady who believed that she was actually looking into hell and could feel the flames of hell rising. And she'd had a cardiac arrest when she was on the surgical ward. And she said all of a sudden everything went black, and then she could see like a big stream or a river, and in the middle of the stream there was a lady in a rowing boat, and she had this straw hat on her head. And she said she didn't recognize this lady, but she knew that she should keep away from her. And she said it was horrible to see her, and then all of a sudden this mist appeared, and then she could see bright lights. And it's almost like, with the fireworks where there's Catherine wheels that spin around very fast.
Hmm.
She described seeing lights like that, almost like those Catherine wheels spinning. And then she started to get really distressed. And she said, "Oh," she said, "no. And this was horrible. It was awful." And she said, "I was looking into hell." Like she said, "I could feel the flames of hell. I was looking into hell." And at that point, she started to cry uncontrollably. And I had to terminate the interview. And she said, after I'd finished and she'd calmed down, she was begging me. She said, "Please tell me I'm not going back there ever again." And, all I could say was that, there have been some experiences that have started off in a very frightening way like this,
Hmm.
but sometimes they've turned into a very positive experience as well, once the person kind of relaxes into it. But I went to see the lady about 2 days later just to see how she was doing. And she said, I really don't want to talk about it anymore because it was so frightening just thinking about it that it's just too upsetting for me. So I never got to the end of her experience. It was just literally the beginning of it I heard. So, these distressing ones, I think we know far less about because there's little research into these. And I think it's really important that we do find out more about them because people like this lady, she needed extra psychological support afterwards to help in her recovery,
Mm-hmm.
And I think it's really important that we kind of research them further.
Do you find that an individual's religious beliefs have any sort of impact on the type of experience they might have?
I didn't find, well, to be honest with you, yes, that lady now who did have that very hell-like distressing experience, she was quite religious. So I don't know whether it was instilled in her from her religious beliefs, those sort of images. But other people in my research, they weren't particularly religious, to be honest with you, no.
Now, I've heard there are people who've had NDEs who have physically recovered and found that they have perhaps new skills they didn't possess prior to their NDE. Have you run across this at all?
Yes, I have. Now, patient 10, who had that the out-of-body experience as well as part of the other near-death experience. Now, he was very interesting because he has cerebral palsy. Now, at the time of his experience, he was 60 years of age, and his right hand had always been in this permanently contracted position. So it was quite claw-like, and he'd never been able to open out his hand. Now, when I was doing an in-depth interview with this man, he misinterpreted one of my questions, and he said, "Oh yeah, look at my hand now, I can open out my hand." So this is something I found out kind of accidentally, and he opened out his hand fully. Now, at the time when I was interviewing him, I didn't realise the significance of this. It was only when I was discussing it with the doctors and the physiotherapists that they said to me that shouldn't physiologically be possible because his hand would be in that permanently contracted position, his tendons would be shortened. So in order to open out his hand fully, he would have to have an operation to release the tendons. Well, no such operation was performed. I checked his notes to see if he'd had any extensive hand physiotherapy or something like that, but there was nothing. I couldn't find an explanation for it, and the doctors and the physios can't explain how he could have opened out his hand. And I've also interviewed his sister about this, and she signed a statement to say that he has never been able to open out his hand until he had his near-death experience. So, to me, I think that is really significant and fascinating because if we could understand how that has happened, if there is some sort of mechanism behind it, think of how many millions of people out there with similar ailments could benefit from some sort of therapeutic intervention that we could develop from it. So, that's really important to me as well. There's another case I can think about as well. There was one lady. Now, she wasn't in my hospital research, but I came across her when I met her at a conference in Marseille in 2013. Her name is Raja Benamor, and she lives in Morocco. And she had a near-death experience. When she went for surgery, she was injected with anaesthetic, and she suddenly went into this overwhelming experience for her. And she felt that she shrunk down to a quantum size and travelled around the inside of her body, and she just had a life review back to the time of her birth and back to the time of the birth of the universe as well. But what is interesting about Raja's case is that it's left her with these intellectual abilities that she hasn't previously had. She is now able to understand quantum physics, and she's never studied it before. And, what was really interesting in this conference is that the organisers had actually interviewed her university professor because as a result of her experience, Raja had become motivated to enrol on a course at the university to study quantum physics. And when they interviewed her professor, he said that it was really a big puzzle to him as to how she had acquired this knowledge, because this is deep-seated knowledge that she has. It's not something that you can just acquire through doing a short booster course or through reading lots of books on quantum physics. This was really deep-seated knowledge.
Oh, I'm so sorry. I guess we got a dropped call. So you were just explaining that the knowledge of this person had surpassed instructor or the person who worked there.
That's right. So the university professor had said some of the things that she'd written about in her papers he didn't understand, but actually they had been verified by publications in scientific, in physics journals that had just been published. So he said, he had to keep an open mind to it because her knowledge seemed even more superior to his. So, that's really fascinating to me. How did she acquire this knowledge when she was deeply unconscious? So, this to me raises questions about consciousness and what is consciousness. And I think certainly since doing the research that I've done, coupled with my work as being a nurse in the ICU, I think that our understanding of consciousness needs to be revised and expanded. And, our current scientific belief is that consciousness is produced by the brain. And I'm thinking, well, maybe it's not produced by the brain. Maybe it's mediated through the brain, but not produced by it. And I think that gives us a more of an avenue to explore with future research as well.
That's very interesting. How has your personal belief system changed, if at all, as a result of this research?
Well, it's totally changed me, to be honest with you. It's made me a lot more open-minded because, like a lot of people, I had misconceptions about near-death experiences and deathbed visions and things like that. I kind of thought that they were just the brain shutting down as it approached death. But, it's opened my eyes to things that I didn't think were possible. And having been there, certainly when patient 10 was having his experience, and to have him report back to me in great detail everything that did happen while he was deeply unconscious, has really made me think, well, I have to have an open mind to this. So it's made me more open-minded, but it's also made me question the way I live my life as well. And I think the near-death experience has a great message with it. These people who have the near-death experience, particularly those who have a life review, sometimes they can experience things from a third-person perspective. So people that they've interacted with throughout their life, they can relive that during the life review part of their near-death experience. So if they've been particularly unpleasant or even violent to someone, they know what it's like to be in their shoes and to be on the receiving end of that unpleasantness or violence. And likewise, if they've been nice to someone, they get to see what it's like to be on the receiving end of that pleasantness. So I think, it's made me think a lot about the way I live my life as well. And also what people think during the near-death experience, they realise that we're all interconnected on a very deep level. And they believe that ultimately what we do to others, we do to ourselves. And I think the message of the near-death experience is the golden rule, which is at the heart of all of the wisdom traditions. And that is, treat others as you would wish to be treated yourself. And I think, I've kind of taken that on board more as well since doing my research. It's made me very mindful of the way that I live my life as well. So it's made me question my own mortality as well. And I think I'm far more appreciative of everything that I have in my life than I was previously. I guess before I began my research, I guess I used to argue with my husband about stupid things, about being late for certain things. And now I'm just grateful that he's here and he's in my life. So it's made me, really think about the way I live my life.
Well, I would imagine that there's people who look at your research and think, wow, this is really a good case for or against life after death. And I'm sure that the decision is divided. Can you kind of share with us any of the more compelling stories that you might have heard out of this, supporting life after death?
Well, I guess one of the patients that I saw during my research, he actually had a deathbed vision, and it was during a night shift, and we'd expected him to die because his condition had deteriorated rapidly, and we'd called his family into the hospital about 3 o'clock in the morning. And after about an hour, his condition actually stabilised. And the family had been called in several times that week, so they were very tired. So they said, look, we know he's stable again, so we're going to go back home. We'll be back later in the morning. And about half an hour after they went, my colleague said to me, oh, look at that patient. And he's kind of regained consciousness. And he started gesturing to people at the bedside. There was no one there, but he was obviously seeing people in front of him that he was gesturing to. And he was smiling. He had this big smile on his face. And he was mouthing the words, what are you doing here? And we all watched him because he looked so happy. And that lasted for about 20 minutes or so. And then he kind of just went off to sleep. Now, in the morning when his family arrived, he said to them that during the night he'd been visited, and the visitors had been his grandmother and his mother, who were both dead, but also his sister was with them. And he said, what was she doing with them? He said, I can't understand why she was there. Now, unbeknown to him, his sister had died the week before, but the family didn't want to tell him because they didn't want to set back his recovery. So he was actually communicating with his sister, not knowing that she had in fact died as well. So I think that was quite compelling as well. And I don't know, you get to hear a lot of different cases, and certainly people have written to me over the years with some absolutely fascinating things, So I think we have to keep an open mind to these things, but I think our biggest thing is keeping an open mind to consciousness and what consciousness is. When does it begin and when does it end?
Well, you bring up a lot of interesting points here. Being in the medical profession myself, I kind of feel the separation sometimes, or actually very often, of what's considered, scientific versus what's considered being sort of a patient advocate. What kind of feedback have you received from the medical and the scientific community about your research?
Well, to be honest with you, when I first started doing my research, I had a lot of jokes made about it, and people didn't take it seriously at all. But as my research progressed, the doctors in particular started to take an interest because they realised that, this was an important piece of research that could potentially benefit a lot of future patients. And I think by the time I finished my research, I can remember the doctors were doing their ward rounds once, and there were some new doctors had just joined to work in the unit, and the actual consultant said, I think afterwards you need to speak with Penny about her research because you need to take on board some points as well. So I think the doctors really did see the importance of it and how it could benefit future patient care as well. There are people who were sceptical as well, and I was quite sceptical myself when I started doing the research. And I didn't set out to prove or disprove life after death. The reason I did my research was try to understand death so that it can benefit future patients, and so that no patient should have to suffer as they're dying. And I don't think any patient should be afraid as they're dying. We should be there to support them through that process. So I think it's okay to get that skepticism, and it's healthy to have skepticism as well. And many people have a lot of good points that I take on board. But also I think we need to really pay attention to what patients are going through as well. And so I think overall I've had a really good reception, and I think, we need to keep that open mind, because at the end of the day, I'm going to die myself, and I don't want to be frightened when I die, and I don't want to be in that position of that patient who sparked off my research in the first place.
Now, if someone listening to this podcast has had a near-death experience and maybe needs, some kind of support, what resources might you recommend for them?
Right, there are some really good resources. There's the International Association of Near-Death Studies. That has got groups throughout the USA, and there's a lot of support groups who meet regularly. And I think that is really beneficial when people can meet up with people who've had a similar experience. They find it easier to work through what's happened to them, because it can be a very overwhelming experience as well. There's also a really great website, the Near-Death Experience Research Foundation, and that's run by Dr. Jeffrey Long and his wife Jodie Long, and they do some great work. They've got great cases on that research site, so have a read through those as well. And yeah, have a look online. There are some very good resources online as well.
Well, thank you. Do you have any plans for future research?
Yes, I do. At the moment, my life is really, really busy, but I'm continuing to gather cases, and I'd love to take the research further. I'm currently looking for a research assistant who lives locally to me, and I was thinking it would be great if someone is a student nurse so that they can take the research forward themselves. So certainly, yes, I'm hoping to continue with the research, and I hope other people will take up similar research as well.
That's excellent. I'm anxious to hear what you come up with. I really want to be respectful of your time. We're about at our limit here, but before we sign off, can you tell us where people can go to learn more about you and follow your work?
Yes, now I do have a website. It's www.drpennysartori.com. And I also have a blog, but I haven't been able to do my blog for about 2 years because I've been too busy. I'm also on Twitter at Dr. Penny Sartori, and I'm about to start a Facebook page, so keep looking on Facebook as well in the future.
Well, I certainly will. And I just want to say thanks once again for joining us here. This has been a really interesting conversation, and I hope my audience finds it as interesting as I have, especially having experienced some of these similar things, not quite from a firsthand account, but I know exactly what you're referring to, and it really just has been eye-opening.
Oh, great. I'm glad. I've really enjoyed chatting with you. Thank you.
I want to send a big thank you to Dr. Penny Sartori for joining us on Deviatus this week. You can find this episode's show notes with all the links she mentioned at deviatus.com/NDE, of course, short for near-death experience. Well, I would absolutely love to hear your thoughts on this episode and our guest. Feel free to come by and comment on my blog post or leave an iTunes review. You can also connect with me on Facebook, or if you'd like to chat with me on Twitter and Instagram, you can find me at DeviatusPod. And of course, you can follow up with Dr. Penny Sartori if you have any questions specifically directed for her via her website, www.drpennysartori, that's drpennysartori.com. So until next time, thanks again for listening. You have a great week.